So if I could describe exactly how we treat our patients that are on this path in 3 steps, it's really simple. First is an accurate diagnosis. This is such a critical element in that in order for us to help our patients get back to a state of health, we first have to make an adequate and appropriate diagnosis of what's actually happening in the system. We're not simply reacting to disease and trying to treat disease as it happens. What we're doing is taking a step back and figuring out what is the total picture here? What's the overall story? And how do we restore our patients back to a state of health in a way that is consistent with the diagnosis we make? Then once we make the diagnosis, we begin the process of stabilization. It's basically getting our patients healthy by stabilizing everything. Getting our joints stabilized with our teeth, stabilized with our muscles, so that the system is working in harmony again. Once the stabilization takes place, we actually make another diagnosis, which is our final diagnosis now that we have everything stable. And then the third step is actually the restoration phase, where if the teeth are not in the appropriate spots or the teeth are worn down and they need to be restored into a more natural state, we can go ahead and do that. But it's always the same approach. It's a diagnosis, stabilization, restoration. And if we follow that path, our patients not only feel better, but their dentistry lasts so much longer, which is incredible.